Peterborough has one of the highest birth rates in the country. At the local hospital, the maternity unit is almost full. Midwives have to prioritise women. For Joanna Koska, that meant waiting an extra 2 days to be induced because the unit was too busy.
Obviously you set yourself up for that day and you psych yourself up and then you ring in, no, maybe later, ring in again, no, sorry. I mean, everyone was nice and polite about it, but obviously you're getting more and more anxious the more days you have to wait.
But it's not just the sheer number of pregnant women that's putting pressure on the unit. The mothers are also getting older and heavier, and that significantly increases the risk of complications. It's more work for midwives, who have to carefully monitor mum and baby.
You've got them in here constantly to sort of, if you need them, or ask any questions that you're unsure of.
How many staff have you got, Johnny?
We have got 4 midwives.
Older and larger mums are more likely to need a longer hospital stay, adding to pressure on maternity units.
Okay, and how many more to go home today?
There's also a risk of diabetes, seriously high blood pressure and other health problems.
It is a consideration that you need to make for their safety whilst they are in labour, whilst they're at a patient. You know, there is a risk of deep vein thrombosis, a clot in the leg. We have to give medication to prevent that because obviously bigger ladies can be less mobile.
Some units now have hoists to lift heavy women, and equipment has had to be upscaled. The beds here are built to withstand a weight of 35 stone, but twice in the last year they've had to hire in reinforced beds because some of the mums are so obese, and the cost £500 a time.
Do you want to have a bit of your tummy? No.
Despite the impact age and body weight have on maternity units, a third of those contacted by Sky News said they didn't collect the data. That alarms the Royal College of Midwives.
If you don't know who you're caring for, how do you know you're providing the right care? Our concerns are that many units haven't necessarily done the full assessment for many years, and even where they have, the trusts are actually not employing the numbers of midwives that it says that they need for their population.
NHS England accepts there is a data vacuum, and it's now started a major survey of maternity units.
We're recognising that knowing this data is really the most important things to improve the outcomes for these women and for their babies. So we're investing in that in order to have a new audit for the first time.
Society as a whole is getting heavier and women are starting families later, but it's maternity units that are having to cope with the consequences. Thomas Moore, Sky News.